Hello everyone, welcome back to my channel. Today's topic is ototoxicity from Medical Surgical Nursing ENT unit. Let's get started with the video. Ototoxicity is toxicity in the air or poisoning in the air which is caused due to exposure to some kind of drugs or chemicals that actually damages the vestibulocochlear nerve. Vestibulocochlear nerve contacts with the brain and creates the perception of hearing. The occurrence and degree of inner ear toxicity or ototoxicity depends on how toxic was the drug for the ear. It ranges from a minor effect to a major injury, but some of the symptoms are characteristics like tinnitus, damage to the cochlea, and gradual hearing loss. Also, the toxicity depends on type of drug. There are many researches among which aspirin, quinine, these kind of drugs and also the antibiotic streptomycin have been toxic for the ears. So since then, because of those scientific studies, the drugs which causes ototoxicity are lesser in use or no longer in use. When there is ototoxicity, this is how there is occurrence of damage to the cochlea. Etiology can be use of drugs like aspirin and quinine group of drugs, loop diuretics, that is continuous use of diuretics like bumetanide, furosemide, or torsemide. Also, aminoglycoside antibiotics like amikacin, gentamicin can cause ototoxicity. Also, anti-cancer drugs and environmental chemicals can cause ototoxicity. Pathophysiology can be there is a specific damage to the ear cells of the inner ear. Those ear cells transmit the audio wave or sound wave towards the brain. So when the ear cells are infected or damaged, then what happens is there is no transmission of sound waves to the brain. Also, it causes hearing loss and balance disruption. The ear cells are located in both cochlea and vestibular areas of the inner ear. They are composed of a cell body with an hair attachment. So, movement of that hair creates distribution of sound. Clinical features can be one-sided or two-sided hearing loss with constant fluctuating tinnitus. Also, the symptoms develop slowly and degree of damage also depends on the level of damage that is created. Sometimes a slow one-sided loss might not produce any symptom, whereas sometimes opposite effect can be seen, like both-sided hearing loss might be seen, where symptoms is seen quicker. Also, patient is unable to tolerate head movement because ear is the organ for both hearing and balance. There is lack of balance in the body. Patient has a wide-based gait and difficulty in walking in the dark. Also, there is unsteadiness or sensation of lightheadedness and unsteadiness, fatigue, and gradually, along with hearing capacity, the visual acuity also reduces. That this disease can be diagnosed on the basis of symptoms of the patients. Also, we can perform vestibular auto rotation test, vestibular ocular reflex testing equipment, electronystagmography can be performed, or dynamic posturography can be performed. Also, we can perform electrocochleography, auditory brainstem response, and autoacoustic emissions. Also, pure tone audiometry can also be used. This is the vestibular auto-rotation test, where a patient is placed in a cavity inside a chamber and then hearing test is done. This is vestibular ocular reflex equipment, where ocular movements are tested. This is electronystagmography, where graphical representation or functioning of all the nerves can be seen. This is dynamic posturography, where patient remains in a standing position and we get a graphical view about patient's balance. This is electrocochleography, where function of cochlea can be found out by using electrodes. Result can be obtained something like this in cochleography. In auditory brainstem response test, the auditory test can be performed by placing electrodes in this way. In autoacoustic emissions, the emission of sound waves inside air can be tested. In pure tone audiometry, the audio level can be recorded and marked, and we can obtain a graph to that. Management can be, first of all, treatment focusing on reducing the effect of damage, and whatever the function is there can be developed into optimum, that is rehabilitation. So, the management should be focused on managing the toxicity. Individual with hearing loss may be helped with hearing aids, either one side or both sides. Also, physical therapy can be used to develop, maintain balance and hearing. There is a position called as proprioception, where multiple organs get blood supply. There is benefit to vestibule, eyes, stress receptors of skin, and also brain through this position. There is some further detail about long-term management. Long-term management can help to improve balance, protecting other systems, and protecting further autotoxic damage. And in proprioception, that involves taking precautions such as avoid walking barefooted on any surface that could injure or damage the soles, not wear clothes that restrict the circulation to the legs or feet, and excess body weight can be taken off. So that weight that can cause knee and hip difficulties, weight that causes difficulties can be removed. Avoidance of autotoxic drugs. Avoid taking multiple types of drugs continuously like aspirin, loop diuretic, aminoglycosides. Also, along with any kind of drug, patient's body needs hydration because the remaining part of any medicine comes out in the form of urine. Thank you so much. Next topic will be discussed in next video.